Hi everyone, my name is Ana Montesioca. Today I will be giving a presentation on a personality disorder case study. The case that I chose is Jennifer. Throughout the presentation, I will give a case summary, I will give a possible diagnosis, and I will also explain my reasoning behind that diagnosis. Thank you. To summarize Jennifer's case, she is a woman in her mid-30s with a generally successful career. She is recently divorced and shares custody of her two sons with her ex-husband. A lot of her problems do come from her difficulties in her romantic relationships. A lot of these problems come from her online dating, where she seeks attention and validation through these relationships, which causes instability. She is also very intense with her attachment styles and the conflict that the relationships have. She demonstrates impulsive behaviors and risky sexual relationships. It's noted in the case that she's not sure what she wants from a relationship, where she'll go in 100% and then decide that she wants to have something open. She would also like a stable stepfather for her kids, and so on and so on. So with all this instability, that then translates into her relationships and doesn't normally end well for her. She also has a history of childhood abandonment, where her father left her mother at a very young age. She also experienced sexual trauma in high school, where she was sexually assaulted, and then she has a recent suicide attempt due to a breakup. She moved away with a man, and when they broke up, she came back home, and that is when her suicide attempt happened. All of these things will then go into what possible diagnosis she can have. Based off of Jennifer's case and the information given, I think the primary diagnosis would be borderline personality disorder, BPD. This is classified under cluster B in the DSM, and it's described as patterns of instability in relationships, emotions, and behavior, all of which are traits that Jennifer's behaviors fall under. To be diagnosed with BPD, you have to meet 5 of the DSM criteria. The 5 that I looked at, or the 6 that I looked at, were frantic efforts to avoid abandonment. So again, where she was broken up with, or there was difficulties in the relationship, she would break up with them and then try to get back with them frantically or very impulsively. Patterns of unstable and intense relationships. She'll meet someone, get into a very serious relationship, she moved with them, engaged, all of these types of things, and they're very unstable and she's not sure of what she needs or wants in her life at the time. Impulsive and risky sexual behavior. It's mentioned again in her case that she feels like she can meet the love of her life even if she sleeps with 100 men. So it's important that we look at her views and her behaviors with her sexual behaviors. She also has affective instability as her emotions change rapidly. So again, from one day she'll have a very loving relationship with a man to the next day hating him. It's even said she has a love-hate relationship to men. For the 2 criteria that are partially supported, it's a recurrent suicidal behavior. She only has 1 documented attempt, so this is only partially supported. This would need to be monitored to see if that criteria is met later on. Partially supported again is chronic feelings of emptiness. The DSM describes it as easily bored and constantly trying to find something new, and this is seen through Jennifer's behaviors of trying to constantly find a new relationship or a new person to fill this position in her life. Again, when looking at the evidence supporting BPD, we can see that Jessica has met at least 4, but she needs 5. Suicidal behaviors and feelings of emptiness are only partially met based off the case that was read. Although these are only partially supported, it's important that the clinician make a decision based off the information given to them. So how long has this been going on? How severe? disorder, the impairment, so how much does it affect their life, and the patterns over time. For Jennifer specifically, this is something that's been going on throughout her entire adulthood. Or at least majority of her adulthood. This is a pattern that's been continuous, and it obviously is impairing her life and the decisions that she needs to make or wants to make. The clinician must look at everything and see personality disorders as a spectrum. Where does this person lie, and what is the best approach to help them move forward? Borderline personality disorder is classified as cluster B, which are personality disorders, because the individuals in this cluster are characterized by dramatic, emotional, and impulsive and erratic behaviors. They have difficulty maintaining relationships, which all are very descriptive of Jennifer's situation. She shows these traits, and also under cluster B, there's also narcissistic, histrionic, and antisocial personality disorders. Although some of Jennifer's traits do overlap with these, like her behaviors and her erraticness, her fear of abandonment, her unstable relationships, and emotional instability most match with or are most appropriately diagnosed by borderline personality disorder based off the DSM. So once BPD is diagnosed, what are the treatment options? First-line treatment, and one of the most common, is dialectical behavioral therapy, DBT. The second would be cognitive behavioral therapy, which helps to manage symptoms. So this is normally used in combination of DBT. Thirdly, there's individual and group therapy, which can help to improve coping skills. This builds community amongst people that have gone through similar experiences, again, just helping them through the process. Lastly, there's medications that can be used to treat anxiety or depression that can come with the diagnosis. Like in Jennifer's case, her suicide attempt was a part of her DBT, and so there's treatment that can be used to help that, her like sadness and feelings of emptiness. For long-term treatment and consistent support, these all support better outcomes for the client, so it's important to do a combination of treatments and see what is best needed for the client and their specific needs. For course of treatment for Jennifer, the two first things that go hand in hand would be completing a comprehensive clinical assessment and a risk assessment and safety planning. Safety planning is very, very important because of her recent suicide attempt, and as for her comprehensive clinical assessment, she can be given a diagnosis. Once those two things are completed and we've ensured her safety, we can then develop a individualized treatment plan. Depending on what is on her treatment plan, she can begin psychotherapy. And as that goes on, then we adjust as needed and possibly do coordinate care with her primary care, medications, or anything else is needed according to her treatment. And then it's important to continue long-term follow-up and support, as BPD, it's most likely to improve with that long-term support and consistency of treatment. For prognosis and prevalence, prognosis is pretty positive, so symptoms often improve with treatment, and long-term therapy can lead to lasting progress. Difficulties with functioning can still continue even with symptom improvement, but again, that's why it's important to do a combination of treatments and make sure that there are follow-ups, checkups, and all of that to make sure there's consistency and long-term care. For prevalence, lifetime prevalence is approximately 0.7 to 2.7% in the general population. It's more common in psychiatric outpatient and inpatient settings, and it's diagnosed in both men and women, but more in women. To conclude, I think that Jennifer's case highlights the importance of looking at all the symptoms in a person's case. I think it also is important to really understand their diagnosis and their story before giving them a treatment plan. This gives the client the opportunity to build healthy relationships and overall improve their life with that kind of support. that's needed. Again, for BPD, long-term recovery is possible. It just needs consistent treatment and support from the clinicians and all providers involved. Thank you so much for listening to my presentation, and have a great day. Thank you.